Sorry about that.
Oh, you're fine. Jeffrey?
Yes, ma'am.
I'm Jennifer. How you doing?
Nice to meet you.
How's it going?
Fine.
I see you got a lot going on. I was reading your stuff and I said, oh, you see on call that girl.
Yeah.
Oh. So is this the table?
Yes, ma'am. Let me just clear it off.
Okay. You too young for all of that mess. So you've been dealing with melanoma?
Yes.
Oh. How long have you been having that?
Since I was 10.
Wow. 10 years old. I don't know anybody. I used to actually work at Children's Hospital in oncology for quite a while on the oncology unit. And,
That's where I was at.
Really? I wonder how long were you there? I was there
I haven't left, technically. I mean, I've always
Yeah.
been there. I always will. They still follow up with me.
Yeah.
They're still the same staff with UMC and
Yeah.
with MD Anderson, so I mean,
yeah.
Morales was my doctor.
Yeah.
And
Did he
then,
leave? Somebody told me he wasn't there.
Yeah, he got appointed to a research position as the head of the research for like blood disorders and stuff.
Okay.
Because you know the sickle cell stuff he was working on.
Yes.
In Boston, I think.
Yeah.
It's some big giant like private research lab that's funded by the U.S. basically.
Okay.
That's his job now.
I wonder if you were there when I was there, because were you ever on the inpatient side? Did we admit you over there?
I mean, certainly for my treatment, yeah. I mean, like for the infusions, yeah.
Yeah.
I mean, that would have happened for seizure testing and stuff, probably.
Because I was on 4 West in 2006 and 7.
I was there in 2008.
So you came right after me. Okay.
Must have been right after you, yeah.
Yeah, wow. So where did you find it at?
That's right.
That is crazy. And you were 10?
Mm-hmm.
Do you have that in your family? Any like?
Yeah. Well, no, like family that has it. Here's the initial site with the incision,
Okay.
and then it spread to distant seminal lymph nodes across my body, and then they did the second and third. The first surgery was like here, and then some here. My second surgery was full lymphdectomy of my left leg through my groin. So you can kind of like see the tip of the scar here, and it goes to about there. And they had the tubing in the tube for draining for the lymph for a while. I was at Children's for the whole thing for that.
Yeah.
They had a PICC line in me like June of 2008 to start the infusions.
So you did chemo like for a while?
I was on interferon alpha 2B, I believe. Yeah. Or B2A, I think. I might have been a couple, but it was like combination for me. I was on the strongest dose they'd ever given anyone.
Really?
And I was the only one to live.
Wow.
They had one other girl, but she was stage 5 when she was diagnosed, and I was stage 4.
You were stage 4?
So
wow.
I'm still here. So I'm the oldest living patient. I'm the only one who actually left Children's Hospital. Everybody else didn't. They're after me though, and I guess her. There was. We are so rare. There was just not that many. There was a bunch of other patients, but they were all put on like the trial for Blvd, which came out like right after us. It came off of our treatment for like my treatment specifically, and so like it kind of because my physician is the one of my physicians at MD Anderson was the researcher who won the Nobel Prize for the Blvd and the other things associated with it. And we were like his patients, technically. Like I may have met him like once or twice, but like at MD Anderson, but I don't believe that girl did because she didn't move around as much. I was the one who was always going back and forth. So do you have
active melanoma spots now?
Yeah, I mean, the melanoma is always in your body because it spread. And
so what do you do now? If you get another spot, you just cut it out as you go?
Yeah, like they've been cutting out a lot of different stuff more recently. For years and years, I didn't get any active new incisions or moles because
look at that.
And like wherever the other bigger scar is.
Right, yeah, I see it. You got 2 on the back there. What's
Here's
on the
another more recent one. There's one too from a couple years ago. So basically, the larger scars that are wherever the hell those are.
I see
those
what's
are
on
a large amount of tissue.
What's happened to the chest area?
Oh, that's from some workout equipment stuff. That's just that's
just a rash.
It's like a rash.
That's
nothing.
Not
No. They've been looking at that, but I used some workout equipment to successfully I didn't actually have muscle tissue here for the longest time because of the cancer and stuff like that. I mean, I didn't grow because of the cancer.
Yeah.
So like I was put on growth hormone. So a few years back, one of the like workout equipment and stuff that I used actually was able to develop some muscles here and like up to my shoulder because I didn't have anything there. It was kind of like just the skeletal structure, you know what I'm talking about?
I've seen the
and
kids
now there's like defined like pectorals and like.
And you know, and they tell you like skeletal muscle mass is like the best thing to fight cancer, like working out and. Like, I've read a lot of articles about people that are doing that now,
Okay, well, I'm glad I was, because I knew that some of the other patients, they had been doing some sort of, like, reconstruction, like, years later, but they didn't really with me, because of,
But you don't look
everything.
small, I mean, you're pretty tall.
Well, yeah, that's because of the growth hormone. I'm glad I got on the growth hormone, I was like, here, I was probably, like, shorter than you. I was, like, 4 foot, like, 9 or something.
I'm sorry you went through all that. I know what it's like, because I've been in there with y'all, and it is bad. It's just bad. It's hard. People have no idea.
I mean, I had a lot more like of my musculoskeletal system developed before I started the chemo because
you were 10 at least.
And I was very athletic. Like I did
like
competition
what's
swimming and
that
stuff.
name that was in there that had cancer? She's a nurse up there. Laura.
If I heard her voice, I probably remember who she is.
She's little bitty. She had rhabdomyosarcoma in the sinus cavity. And she's tiny because she went through all kind of chemo and stuff too. Well, then she became a nurse and worked there with all of us. When I worked there, I worked with Celeste. Morris was still there. He was there. Dr. Gardner was there. Dr. Yu, she was there. She did all the stem cells. We did the first stem cell transplant there, in fact.
I think I've met Dr. Yu. I remember her name.
Vietnamese lady. She's mean as hell.
Yeah.
I'm trying to think of who else was there. And then in the clinic was Claudia or something was her name. God, she was in the clinic forever downstairs. She's probably still there. And that little Vietnamese lady that used to do all the blood transfusion. They have the best staff, I will say that.
Yeah, they were a great clinic.
Yeah, the people I worked with were like amazing. But I was looking at your chart and I'm like, oh my God. I'm like, what is going on
here? I'm surprised it doesn't show Children's Hospital there. You guys might want to like pull the records. Because MD Anderson has everything, and I think they're up to date relatively, but you can go to MD Anderson.
So what do you do? Go yearly or every 6 months to have somebody, you just do the full body check?
I go every 3 months to get...
Every 3 months?
Every 3 months, because it's 6 weeks, and then it'll be entering my body, so they have to be on top of it. And
so they cut it out immediately?
Yeah, and it's been very close a couple times in the past, like just in the past few years. I went probably 6 or 7 years with nothing developing, because they surgically removed under, the knife and under, like, they did MRIs of me while I was in surgery and stuff like that to make sure that there wasn't anything, like, that could develop from, like, I guess, the depth of the skin and stuff like that, like, even acne and things. They were just removing some skin and using lasers for other stuff, just on, like, at the same time they were doing the other surgeries, because they were going to be in there for a while, and they just wanted to make sure that there were, like, a much lower chance of reoccurrences, because...
So did they do genetic testing on you to see if you had some kind
They haven't found any link with me or any other patient they've ever had childhood melanoma with. There isn't enough of us to, even though my whole, like, genetic chromosomal structure has been, like, genotyped and phenotyped.
Yeah.
They have it on file. It's on research databases and stuff. You can type my name in PubMed. If you go to, like, the global portion of it, so if you, like, go to PubMed and then you, like, hit the tab and you go all the way out,
I had kids with melanoma, though, like, once in a while, but rare.
But it wasn't the same type as, like, us, because we were, like, a different category because of our age, and there's an entirely different type of melanoma that every other kid usually gets, and they're usually a few years older, and that's much more common, but for us, it's like a genetic thing, and that's why we're all in the database. Like, you can literally just type my name in, and it'll pop up.
Do you keep up with any of the other people that, like, you're in the trials with, or,
No, everybody else is dead, so, I mean, like,
I
don't know. I mean, I didn't know anyone else because they were older than me, and they died before I even started treatment. And then there was the only girl I met was that one girl, and she was much younger than me. But I think she started treatment when she was 5, so she was, like, 10 whenever I met her, and I met her when I was, like...
Jesus, your poor parents must have been
13, 14. Around there, and I don't know how much longer she lived after that, but she had made it to 5 years, and she was in a much worse state than me. I was very, very fortunate for how everything worked for me.
Yeah.
She was like, she wasn't really communicative to speak and stuff. She had even worse, like, neurological damage. She had, like, damage to her, like, bone marrow and stuff, too, and a bunch of other things, because, her immune system had just attacked everything.
How many years now? You were 10 and you're 27, so you've gone 17 years.
Well,
in a sort of remission state.
I mean, they don't. They tried to call melanoma remission of like maybe 5-6 years ago, but they stopped. It was too much of an issue for them because like I don't know why they were even trying to, because remission like is defined as not having active cancer, but melanoma is literally active cancer,
all the time.
And that just didn't make any sense. And honestly, that was like pretty infuriating.
Every 3 months? Like where do you go? You don't go to MD
I go to UMC, but they send students from MD Anderson back and forth. I mean, my doctors at UMC go to MD Anderson, just like Morales was from MD Anderson. And
I knew he was.
And he would, go back and forth depending on what they needed. I mean, Bolme is my current primary oncologist, and since most of my stuff is handled by the military anyway, just like it was when I was little, they held all the records and stuff for diplomatic purposes for all the patients. For me, it worked out just because I had already had signed up with them for some other stuff before I had cancer, for like future stuff, because that's a normal thing, especially for boys. You usually see programs like that start with like the Boy Scouts and things, and it goes on. And I had done that too. So like they had extra reasons to hold my records. They just never intended to see me like turn 18 or anything, so where I could do anything else. But by that point, they had already had me cleared with my oncologist and stuff to do programs for ROTC and things. So I was in uniform and stuff. But that gave me access to other things that were just helpful with UMC, because UMC is right across from the VA. Bolme is a VA doctor, and he's one of the heads of the treatment for the Cancer Research Center. So like he can just go in and out of any of the buildings.
So do you take oral maintenance, chemo, or anything like that, or no?
I don't know what he said they would do for me in the future, but he just made sure to let me know not to be concerned about it, because the newer treatments were so much more successful that and because of how monitored I am, it probably is like extremely unlikely that I need something like that. That would be like if God forbid something happened and like I ended up getting to stage 5. I think I'd probably need something like that, because I have heard of it, but
and on your ankle.
They didn't want to do any oral infusions in the past with me, because I had already had stomach ulcers. And I got my stomach ulcers treated at Children's, and they checked up on the stomach ulcers a couple years. The first year of COVID, they finally were able to check up on that again at UMC and scope me again. And just to make sure, because there was a lot of medications I was restricted from, because they wanted to check years later to see how the ulcers were, because that was a major issue because of how fast they developed, just within the 1 month of like intravenous infusions. And from that I was getting the ulcers, not from like other oral medication. It was like that, and just like imbalances of other stuff. I didn't have.
Do you work? What are you doing?
Yeah, everything was intravenous. They didn't have any.
I was just curious. You know, with like prostate cancers and all that, they're doing a lot of like.
I mean, they have some like maintenance dosages for stuff like that.
And breast cancer, we're seeing a lot of that too, where you're just kind of like taking a dose every day and it like wards it off, kind of thing. But I don't know. The nature of melanoma is weird.
Melanoma is a bit too. It also divides too fast. So it might just always be one of those things where they might need to do infusions, or they might need to put a port in there or something.
Cut it out. They just cut it out. Nowadays it's like find it, get it out.
Thankfully I had it on my ankle, so they were able to get everything in my leg. And that
saved your leg.
That's pretty. They had spoken to me originally about amputating my leg. That was the first go-to, but they were like, no, because of his age and because he's a boy, that we have a lot more options of how to do the surgery, and so they were just able to get just the lymph nodes out, and it ended up being fine. It would have been different if I was a girl. It would have. They would have probably had to amputate.
So are you working? What do you do now?
I'm retired.
From?
Everything. I'm just retired. I'm on Social Security.
You get disability for being ill and stuff? Okay, good. All right, so I'm going to put you ain't seeking work. We're going to put that you retired. Okay. Good. Okay.
Oh, yeah, sorry, I don't know what that...
It's a goofy questionnaire, so just follow me.
No.
You're going to be like, these questions...
I didn't realize if I hadn't updated you guys with the statement of benefits yet. That's my bad.
I'm here to just... That's what I do. So, like, I'm just going to ask you a bunch of, like, stupid stuff of, like, oh, you live here, you work, you this, you that, are you happy? It's a goofy thing. But it updates everything and we send it to you primary care. I was just curious about the cancer thing because I'm like,
oh no, that's fine.
I just
That's
did
part of my
so
medical.
much of it, yeah. And like I was one of those people, you know, you have these kids that come in and you have to do things that it's not an easy job, like as a nurse, to like do this to all these poor kids that come in. You know, y'all come in, you're 10 years old, innocent, and it's good to see people doing well because when you work inpatient, you don't see that. Like most of my kids, they died, you know, I never did. I bet few that like made it, but most of them didn't, you know, like, and it was, dude, it was tough. It's one of the reasons I left, because I was like, I can't do one more situation with this, with these kids. And so I always just think about y'all. So I was like, oh my God, when I saw that, I was like, oh, I wonder.
When I was there wasn't anyone else there with me. It was just, I was alone.
Yeah.
Things had gone on with the city to where they were moving patients out of the state.
Yeah.
With other types of cancer, because they had gotten a few treatment centers in like other states specifically for specific types, so they were able to just, you know, triage everybody with that over here and just put them and their families there permanently and just move them away.
So do you live here by yourself, or is this your family's place?
My family owns it, yeah. I lease it. It's mine.
Good. So you have your own space.
Yes, this is my space. Yeah, I lease space.
Okay, good.
I still have issues with my parents, and my mother is still causing trouble with like that, but she hasn't really had that relationship of understanding that there's, you know, I've been paying the money for years now with Social Security for renting stuff, and they've had constant issues with law enforcement with not understanding what they're allowed to do and not, and she's been doing that this past week again. But I think she'll learn pretty fast now that she's having to deal with my father's care more with his Alzheimer's. She's going to have to understand she doesn't live here and she has another place to live, and it's with him, and they can't be living with me anymore. They've assaulted me too many times, and my father's condition's getting too worse. And she's
so not only did you have cancer, you had all kind of stuff with them?
With them. Mainly with her, really. She's the problem. But I think it's going to be able to be handled, probably. But, you know, just because there's no reason for her to be here. With her history, you know, I think they're going to end up prosecuting her.
So she was physically abusive to you as a child?
Well, maybe less so back then, but definitely when I got older. But her, you know, she kind of drinks a lot.
Oh, she's done well. Okay.
Yeah, no. But she, you know, she's got my father to take care of. So.
Yeah. Do you have siblings?
Yeah, my sister.
Yeah.
My sister lives out of state, so she's kind of able to get away. You know, she got married recently. She was able to get away. But that's about it with her. I don't really communicate with her much, but.
Yeah. So you kind of fending for yourself, kind of.
Yeah. But I think things have been better since I've been here.
Yeah.
I've only been here for a year, or less than a year. But you know, I liked where I lived previously as well. But you know, things got worse immediately. Then, so after I guess my father's diagnosed with Alzheimer's and decline, my mother's had more opportunities to just kind of do whatever, and so maybe I can't live with them ever again. So it's just how it is.
Maybe not. Yeah. Maybe it's good to be on your own though. You know, like this could be good if you can work this out. I mean, you're 27, you're getting some money, and hopefully we'll see what we can do to help you out on our end. Do you get veterans benefits? Because you talked about the military.
I'm not a veteran.
Okay.
I was a commissioned officer, so it's different. And I didn't actually get deployed or work in any capacity, so I don't qualify for any of that. But because of my disability being disabled, you know, clearly as a child, and that doesn't actually prohibit you from serving in the military in any capacity. Especially not when you're smart enough to be passing like above all of the enlisted tests and things like that. And because I already completed ROTC.
Did you get to go to school? Like when
I was in school. I mean, in high school, I finished the actual ROTC program. So I'm like, I finished the college ROTC in high school, and but so like at LSU, I was technically would have been a graduate. Level. I was
back to normal living. You did treatment and got back to going.
I got back to going. I did a lot of different stuff with the military in high school and after high school. But it didn't really. But none of that would qualify me for VA veterans benefits because I was never in the Army. And the Army is the only one I believe who actually gives that out to people who were disabled and still had some military service.
So you do Medicaid now?
Medicaid. Every other branch just doesn't do that. It's like that's like a specific thing for them.
So is your primary care doctor Callie Linden?
Mm-hmm.
Okay. And you see her, so that's correct. You've seen her in the last 12 months, I'm sure, huh?
Yes, ma'am, that's correct.
Yeah, you followed up with her. And you have 4,000 doctors on here, so we don't need all them. Okay. So they have you listed that you're dealing with allergic rhinitis, so you have some allergies. They have that you suffer with an anxiety disorder. If some of these don't apply, we'll clean them up along the way.
Yeah, you have to remove that one. I don't have a
You're doing
diagnosis of
okay.
anxiety disorder. I've never had a diagnosis for any mental anything. They've actually prohibited people putting that on my records because that keeps almost getting me killed, because there's a lot of medications that will cause me to die if I'm put on those by force.
Take them off then.
And I have no idea why they keep, why those diagnoses keep getting on there. I have a psychiatrist, and she's gotten extremely upset about people overriding her because she's at the top of the state for psychiatry, and she kept having people like put in notes and stuff, and then it would just
take it off.
And they just wouldn't. They refused to take it.
We'll clean it up, so we'll see. We're gonna see as we go through. We'll see what we can do. Do you have ADHD still? You being treated for that?
That's
okay,
still a diagnosis.
Are you dealing with chronic pain?
Yeah, from cluster migraine headaches, yes.
You do have that, okay. Do you have joint pain and bone pain from all the chemo and stuff, or you're okay?
I have neuropathy. Everything with me is neurologically related because of the damage from the treatment. I don't have explicitly any damage to my skeletal structure or like my like the ligamentation. Not that I've been told. They have done tests in the last maybe like 4 years ago for nerve-related like ligament damage, where they just stuck needles in various places in my arm to like target between the like the musculoskeletal like bindings, so they could like just make sure, just because I was pretty athletic, I didn't like block their ability to like see in other scans, because they weren't able to tell with like CAT scan and stuff. And they told me that it looked like my ligaments were fine, but I don't know if I've ever gone to a specialist for just that.
Well, if you ain't having pain, I wouldn't worry about it.
Okay.
They have you as depression, but you're not depressed.
I'm not depressed. I've never had a depression diagnosis. Why? I don't no idea why that's on there. If you could send some sort of support ticket to
it'll be removed, though. Today, we'll clean it up
ridiculous.
on here.
That's very dangerous.
You have the dermatitis on the chest. I guess we can call that dermatitis as a rash, whatever that is.
Oh, and the back.
And you have it on the back.
Mm-hmm.
Epilepsy. They have you that you've had seizures?
Yes, I have epilepsy, the diagnosis,
Wow, okay. You have history of falling. Have you had some falls?
Because of the epilepsy, yes.
Oh, wow, okay.
With the grand mal seizures, falling because of that. So they have me down as a fall risk just in case.
Oh, gosh,
So at the hospital, sometimes they put the, the green armband on that says fall risk on it.
Yeah, because of that, okay. They have you for IBS, where you're having issues with the bowels, or is
I
that
don't have
okay?
IBS as a diagnosis. That's ridiculous. No, but I do have issues with bowels, but it's like chemotherapy, cancer related.
Yeah.
It's related to the nerves, and I have I have treatment for that now. That's dicyclomine. You can add that to the list of medications.
Okay.
But that's not IBS related. I know IBS is an entirely separate diagnosis.
And they also got you for narcolepsy.
Yes, that's correct.
So you fall asleep sitting up, or that's part of the seizure? Like, how does that work?
Narcolepsy, I'm always asleep. I'm permanently sleep deprived, so I'm always asleep, unless I'm on a stimulant, and then I'm not asleep.
Really?
Because I can't produce dopamine in my brain because of the damage from the treatment.
Really?
So the stimulant produces the dopamine after it stimulates the specific proteins in that region of the brain. Those proteins automatically stimulate production unless you have too little of them, which you usually lose from different types of chemotherapy, or you can sometimes just not be born with them, or born with the capacity to make them later on.
Interesting.
So like I made mine already because I was 10, so I was grown enough to have them.
But then they were damaged.
But then they were damaged immediately, and you don't make more. You make them when you're like up to like 5 years old or so, and then you have all of the ones you can have for the rest of your life. So
are you tired all the time? Do you feel?
Well, I never have anything that isn't tired, So it's like it's impossible for me to say like there's no like
no up and down.
Yeah, there's no up and down. It's just
one state of being.
One state.
You're very smart. I'll tell you that too. Okay, well you've been through it. Listen, what do I always say? Experience is the best teacher, right? You go through it, you learn some stuff. Yeah,
it was very confusing to me when they diagnosed me with narcolepsy because how it was described to me, how I should be like sleeping and stuff, and I'm like, what do you mean? I'm not asleep. And then they finally had to explain to me that like he had to like print stuff out, like show me on like the computer like the documentation for what the actual diagnostic criteria was and like what it was on a technical level. And I was like, Oh yeah, no, I do that. Yeah, that's what happens here. And I was giving them like dates and times and stuff, and they were just like staring at me like, these were things you should have told us the whole time. Because they were like trying to fight for like find what diagnosis to structure for me, because they were like, he has all these different problems, but we can't figure out what it is. And then it was like I just wasn't giving them the information because I didn't understand that I was asleep.
That's bizarre. You've had some weird stuff happen to you. I'm gonna tell you, I've been in this for a while.
I mean, whenever I was asleep in class, everybody always just thought it was because of the cancer. So whenever anybody would ask, like, students and stuff, my peers, like, because they were concerned, or, like, were interviewing them for other reasons, like, even across my life, because went to school with the same guys, and went to high school with them and stuff like that, same classes and everything, and they were there when I was on chemotherapy, too.
Yeah.
So, like, it was, they always just would say, oh, no, it's just because Jeffrey has cancer, and that's always what they had on record.
That's
and
freaking weird, huh?
then it was like, oh, no, that's not because of the cancer, or it's not just because of the cancer, it's because of the damage on top of like the cancer.
So I'm telling you, that chemo ain't no joke, man. Especially as a little kid like that. You guys go through it. I've seen it.
It took 5-6 years probably for them to kind of nail that down, but
yeah, I bet. I've never even seen that or heard of that. All right, so as far as the medications go, are you able to afford the medicines, and are you able to go get them all picked up?
No to both. I can't afford them, and I can't pick them up. But I can, I have them, my main medicine for my epilepsy and my other medicine for my epilepsy, which
so
both of them are...
I'm going to go through these meds with you. You tell me if you're still on them. They got you down for Adderall 3 times a day.
Yeah, I'm on that, yeah. But picking that up is really difficult because of the issues with, like, going back and forth. My insurance doesn't give me, it doesn't have transportation pharmacies.
Okay, I'm wondering if I could get you some kind of delivery. I'm going to set you up with a case manager at the end of all this, and we'll send a referral to them. And then when they call, I want you to talk to them about some of this stuff to see, can they do a mail-out package to you? There is such a thing where, like, they'll mail out the medications for you or some kind of setup, and we'll kind of get there, too. Are you doing the azathioline nasal spray still? I like that stuff. How often are you using it?
As needed, really. I don't really take it every day, but if I were to go outside more, especially during the spring, I'd have to take it every day.
You're probably afraid of the sun, though. Do you even want to go outside, or you don't worry about it with the melon? You just hell with it. I don't care. Yeah.
It wouldn't matter. I have a much greater chance of dying because of the flu or COVID or something than I do from the sun.
I'd probably get to that point too. It's like you just gotta live your life too. Okay, they have for some reason benzoyl peroxide topical. Do you use peroxide on your skin or something?
Yes, that's for acne and stuff sometimes. Yeah.
Okay.
But I haven't been able to get that much because I can't afford it. Yeah.
Okay.
And because that's been difficult to get covered. It was difficult to get the Adderall fully covered, but now that a judge has ruled on it, it's always covered. So that's not an issue with coverage. It's just an issue with maybe being sent to like 5 different pharmacies around here, and some of the pharmacies are refusing to fill it because they just don't want to, even though it's definitely
a shortage too.
Yeah, and there's another shortage. And so if I had transportation or something, or some sort of mail thing, that would probably solve the issue.
We need to set up something, because you can't...
I'm not supposed to be off the Adderall because I can't stop
you gotta go crazy like that.
Well, no, I can't stop the seizures from happening if I don't have it.
Yeah, you can't do all that. We gotta get that figured out. Okay, Cipro with the ear drops. What's up with that? Are you still using that? Or you had an ear infection?
Oh, yeah, I was trying to... I think it only recently I got that at the pharmacy. But I had an ear infection in May, and it took until now to get it all through for that. So I think I have it upstairs in case I get another ear infection. But I do get...
It took you 3 months to get...
to get an antibiotic for my ear that I was supposed to take that same day, yeah.
Okay. That's ridiculous.
It is pretty ridiculous.
Yeah. Okay. The clindamycin topical cream.
I think I just got that as well, like this week. And that's been something that's been going on for like a year or more.
They gave you that one?
Mm-hmm.
Oh, these people. Okay, so how often are you using that? Once a day?
Haven't used it yet.
Okay. What's it for?
Acne. It was prescribed by a dermatologist as well.
Okay. Well, they probably won't want to I'm surprised they covered it. I mean, it's disgusting. Insurance is terrible.
My insurance is they just hear it from the doctors and under the melanoma context, and they're usually fine with it.
They should be.
They just don't like dealing with the pharmacies because the pharmacies end up just like not believing that the insurance will cover it, so sometimes they don't even submit something, and so then they have to hear from me directly, sometimes in person, and they're like, oh, it's him, okay, yeah, we will send something in, and then it gets covered, but like they might not do it because they're just like, because they see it not get covered 1,000 times,
right?
So they just
you're kind of a special case. So.
Yeah, and sometimes they don't. I don't know how they forget my name on the list, but they do have thousands of patients, so I guess it's not really.
There goes. All right, the Adderall. Okay, the dosage on here is weird. So you're doing 2.5 3 times a day?
No, I'm doing 40 milligrams per dosage 3 times a day, and it's split up into 3 different prescriptions because that's how it was able to be filled because of the shortages.
Oh my god.
But my actual dosage per dose is 40 milligrams. 3 times a day. It's been that way since I was like 17 or 16, maybe.
So what's the 3.75 is another divided dose you have to get.
Why does it say 3.75?
There's 2 separate things on here. One could be wrong, so maybe that's an older thing, or somebody else tried to kick something through. So I won't click that one. So you're only doing the 2.5. That's so correct. Okay.
I don't know. I'm doing 40 milligrams. I don't know what 2.5 is.
However, they break
No, I'm doing
down.
40 milligrams 3 times a day. So
3 times a day.
So it's 120 milligrams per day. I'm not really sure.
It's weird how they have it.
I would just leave it as is because I'm not really sure what what they're doing with that.
Oh, they're covering it.
Yeah.
Okay, diplamine, 10 milligrams.
Diplamine, yeah.
You take that as needed?
I took some earlier today too.
Okay.
Yeah.
And that's for the
stomach.
So we have to call it IBS because they don't have another diagnosis, so that's probably how they classify that to get it paid. Some of these crack diagnoses will be more about payment than they are about reality.
Leave it as is, I guess.
I'll tell you.
I know my gastroenterologist, like the chief of their department. He told me it was an IBS.
Yeah, exactly.
So
but there's no name for this.
But if there's no name,
you're
then
just one of those people that fall into this super bizarre category, and it's very difficult to make these generalizations. And it's like.
I mean, I'm fine with that. I just don't. I just can't have depression on there, and I can't have anxiety because both of those have drug treatment regimens. They could get me killed because of the epilepsy.
In trouble. Yeah. Okay. Another nasal spray, fluticasone. You taking that one?
Yeah, it's the same with the azelastine. Both of them are combination to match a different prescription drug that still hasn't gone on to generic yet.
Okay. And then that's 50. Mirtazapine, 7.5 milligrams.
I haven't been taking that in years. They only trialed that with me for like a week, and then they got me off it.
And what's up with the eye drops?
I haven't been able to get that covered. I'm supposed to have that covered, and I'm supposed to be doing it for dry eyes. They test my eyes like they just did a few weeks ago for melanoma, because that's one of the earliest sites they can see it.
Yeah.
And they keep telling me about my dry eyes. I had a doctor, I think Dr. Chen, who was my doctor that day, and he tried to get it for me again, and they still haven't. It still isn't working.
Ridiculous. Sodium fluoride for dental.
I'm trying to get a renewed prescription from my dentist for that. It hasn't worked out with yet. They haven't contacted my pharmacy to send this prescription in, but they have in the past. It just took for me to be there at the appointment.
What's that for?
See my. That's what that's for.
You still getting those ulcers and stuff, kind of thing, or?
That's something related to the treatment, but it's just I don't have the structure properly, like with the gum.
What do I call that?
I'm not sure. They didn't know what to call it back then, but at MD Anderson, they had some of the girls who worked with the genetics department on the stem cell therapy. They were the ones who were talking to me initially about that. They expected me to have issues with that because they had some elderly patients.
Yeah, I had a patient with that too. I don't know what we call it.
I don't think they still have a diagnosis for it yet either.
That's probably half of your problem. I don't know what to call a lot of this stuff. Okay, valproic acid, 250 milligrams. You taking that?
Yep, that's
one a day.
No, it's 250 milligrams in the morning, 500 milligrams at night. Of that medicine, and that's
for the epilepsy.
That's for the epilepsy.
I mean, both. Why do they have you as anxiety and depression? You're not even on anxiety and depression medicine.
I have no idea.
Okay.
That's bizarre.
Oh Lord. Okay, what are you allergic to?
Lactose proteins, like milk proteins.
Okay.
And latex.
Well, they need to start covering this stuff for you. You've been through enough. I get so annoyed, when these. I just I have I don't work for the insurance company, but I work for Signify, which does these evals for the insurance company, and I want to like yank my hair out when I see these kind of things going on. It just makes me really, really angry. But okay, so you had a debridement done of a mastoidectomy cavity, simple routine cleaning. What is all that? Did you have an issue with a tooth or something? Why is that on there?
That's the tooth that's right here that can't really tug on.
He's trying to get this paid for. The dentist is putting all this stuff in here.
Yeah, I just leave it there.
Okay.
He got it covered before. It was just that
he had to sell his soul to get it done.
Yeah, and he just needs to send in another prescription renewal for it, and he's busy, and I haven't been able to really contact him about that. I'm trying to get another procedure done with DentaQuest. They actually sent me this form. I can go get.
I'm gonna put that stuff in here too because.
They just gave me this in the mail yesterday.
Are they willing to pay for your dental stuff?
No, well, they're making it a pain to do stuff.
They're supposed to pay for it if it's medically related. You may have to get rude with them.
Yeah, this is what DentaQuest sent me the other day. My dentist sent in the wrong code for something, and I spoke to DentaQuest on the phone about it. Then I gave my dentist the right code from them, and then I guess this happened.
So what procedure is it that you're trying to get done now that you can't get done?
That's a titanium bracer that's there for my epilepsy, or permanent retainer.
Okay.
It's like fused to the teeth, and he needs to fix like part of it.
Yeah, they need to pay for that.
And it's covered too.
Yeah, it's covered.
But they are having some sort of issue with the dentist and them, like with billing codes or something, and now they are claiming they can't see the dentist's request for a fee or something, and I don't know if the dentist. I also think the dentist probably has like some staff that's incompetent, but maybe not like that incompetent. Cause I don't think they sent in a 000 code. I mean, the code they sent in that she verbally like spoke to me on the phone about that they had sent in, like that DentaQuest received from the DentaQuest employee, was definitely not 3 zeros. It was like some other numbers, and it was just an old billing code.
They don't want to pay for it. So I used to work for an insurance company, and anything chiropractic, dental, vision related, we would pretty much deny all the claims up front, almost every one of them, regardless of what came in. We used to get emails that said deny these claims. We didn't even read them. That was half the reason I quit. But the reason that they do that is because they want to weed out all the unnecessary stuff. But what sucks is they overwork these dental offices. They make it very hard for the dentist to like get it approved. But I think they want to do it because they want to weed out unnecessary, but then it's like when it's necessary, it's obnoxious. You know what I'm saying? You'll get it paid for eventually. They're just going to make you want to like go nuts on them, which is terrible. So that's pitiful, but.
Well, because I don't think my dentist's office wants to even bill the insurance anymore, and I'm not.
They have to.
Yeah, I know. I'm going to tell them that I'm going to.
Afford it.
Well, no, it's not that. It's by law they're committing insurance fraud if they don't send in the codes.
Right.
They're not allowed to make me pay for anything, so I'm on Social Security. It's a felony. So I'm like, I'm just going to report them.
And any dental stuff.
I'm just really sick of it.
Related to a medical diagnosis, your insurance needs.
And my insurance seems like they're going to cover it, no problem.
They're supposed to.
They didn't seem like at all to be denying it when I was speaking to them on the phone, but they got the wrong code, so they couldn't do anything about it.
Well, then they
can
send it back.
Since I did give the dentist's office the right codes, and they still haven't. It still doesn't seem like it's working. I'm not sure if this is from 3 weeks ago or something.
Yeah.
And then maybe there's some time lapse because it was forwarded in the mail. But it's weird that it did take a while for it to come to me.
Mm-hmm.
Because I called them a week after they should have put the codes in, which they did, and then I hadn't gotten a letter yet. And so this should have come a month ago, and it came this week. And that's kind of, or like later in this week.
Okay. Oh, Lord help it, huh? It's always.
I mean, it did say
But
the
you'll
PC'd his office, so like they should be getting
paid
this.
because you will get.
I mean,
that
there was
paid.
the surgery, 2 surgeries I had for this.
Yeah, you gotta have that.
I had to pay for that, even though that should have been paid, but it was too necessary to get done immediately because I could have died. I was having too many seizures related to it, so I just had to pay for it, and it was really prohibitively expensive. You know,
Did they reimburse you?
No, there's no reimbursement for me. I don't get reimbursed. It's illegal to reimburse me, so that's why it's illegal for any medical anything to be billed to me. And my dentist's office, they gave me a thing to bill me. They didn't want to even admit that they could get it prior authorized. Like the workers didn't want me to do. She wanted my credit card information.
No.
I was like, that was stressful because I was about to just pull my phone out and dial 911 and then just keep talking to her because the deputies know who I am. They're gonna walk in there and they would probably. I didn't want their reputation to be hurt just because of like one employee who's just dumb potentially. So, but they kind of backed off on that and let it kind of and started to actually work with them. But they just were saying, no, it's our policy that we don't want to do this. And I'm like, I've been to the dentist for a while, but it doesn't mean I've interacted with all the staff.
Right.
And
some people don't quite understand how it all works with insurance, but
and I don't think they do. Yeah.
Probably not. All right, family history stuff. Do you have anybody in your family with cancer other than you?
Alive currently? My great aunt, but it's unrelated to me.
Okay.
She has lymphoma of the brain.
And anybody with diabetes in your family?
No, I don't think my father qualifies anymore.
People with mental health disorder in your family?
No, not that I know of a diagnosis for my mother, so I'm just gonna have to say no. But no one's had a mental health disorder in my family.
In the last year, have you gone to the ER or the urgent care?
I may have gone to the urgent care to get like a vaccine or something.
No, just for like being sick.
No.
You're not going in there at all. Okay, but zero for all these.
I don't go to the ER. They don't let me go to the ER.
Yeah, you go to your specialist. Yeah.
Mm-hmm.
I remember our kids doing that all the time. Okay. Compared to other people your age, how would you describe your health? Very good, good, fair, poor.
I mean, I have terminal cancer, so probably poor.
Right. Although I will say, you're doing pretty damn good for somebody with that diagnosis. I don't know. I'm
just trying to be accurate because I would agree.
I would say
but,
it's not great. Yeah,
I've stopped saying things like that whenever I'm asked questions, just because I used to mess things up with that.
I know, but I mean,
and I don't want to mess anything up with that now.
I know you get a sick sense of humor when you start dealing with stuff like this long enough. I get it. Compared to 1 year ago, how would you rate your physical health in comparison to now? Would you say your health has gotten better, the same, or worse?
Better, probably, because I have more food now since they got SNAP for me.
Oh, good.
Before I didn't have any food, and most of the time I still don't have food, but I'm not eating 3 meals a day, stuff like that. I don't have money for that.
Yeah.
I make $900 a month, so I mean,
it's just not enough.
and my parents take most of it, so and they don't buy me food, or do any. So I mean, like, but I have SNAP, so that means I get some food. Yeah. And that's been a big change.
Yeah, you need that.
So I'd say probably my physical health has gotten better. Yeah.
Okay, good. Your emotional health over the last year, is it better, same, worse?
I'd say a year ago it was much better because I didn't know I was going to be forcibly moved here, assaulted to get me here.
Why did they make you move here?
Because my mother's, I don't know, she's hurt. She just does things, and she just thinks things and does things. She tried to drop off paperwork and forced me to sign it the other day. I more or less reported that to the police now. Yeah. I've changed my alarm. I have an alarm system now that I pay for because I need to be able to have some sort of ability to get them removed from the building instead of them just claiming that they own it so that they can stand there while laughing at the deputies like they have done before. And the deputies send the SWAT team in. So like they have rifles and stuff. They don't just come with just their sidearms. My mother's done stuff like slamming me against the door and things like that. Or a door into me when I'm on the ground and stuff like that. So I mean, like they just do whatever they want because they own the property. And if now that I have paid for ADT and stuff, I can probably get some guarantee that law enforcement's gonna be allowed to actually like cuff them and like lead them out instead of just because they have somewhere else to live, you know. So it's not like they don't live here. You know. So I mean, even though I also paid the bills previously, I probably have an easier chance of being safer now. Yeah. But my mother still is demanding that she lives here whenever she wants and stuff like that to try to like change that. But that's just not gonna work. I don't see anyone and local law enforcement just tolerating that with her history of what she's done and stuff like that, there's no way they're going to just be okay with that. 'Cause they don't want to be responding here a bunch when there's kids who could be playing outside and stuff like that. There's like a playground and stuff. Like, you know, it's like, that's not going to happen. They're gonna end up throwing her in somewhere.
Yeah, something's gonna happen. Hopefully that doesn't happen, but.
I mean, I don't really care if that does. It's not gonna change anything for me or my father. It would probably make our lives better.
That sucks, man. That's the worst. I hate when people act so nuts. Have you had a flu shot in the last year?
Definitely. I don't know when though. You'd have to check with UMC. They have my records for that now.
Do they give you the pneumonia shot since you're so immunocompromised, or no?
Yeah.
It's only 27. Are you
No,
good?
they do. I still have to go a year to wait for it because if I have it too many times, there's issues, and I had it like 10 times when I was in high school.
Make the immune system go wacko.
Because I did some volunteering at a hospital and stuff like that. So because
Did
of
they give you
those,
a
I
shingles
had to
shot?
have the military vaccine too. And
Yeah.
so and apparently that included the pneumococcal strain.
Okay.
So I ended up having like 4 pneumococcal strains in like 3 months or something like that. And they were like looking at my
Overkill.
Yeah, my primary care doctor, she was talking to me about that in like May.
Yeah.
She was like, I went through and looked at this just now again because my records got like reconciled or something.
Yeah.
And they were like, why did this happen? And I was like, oh yeah, that. And they're like, yeah, you can't request another pneumonia shot with the nurse. Whenever she asked me, have you had your pneumonia shot yet? And I'm like, I don't know. She's like, okay, we'll do it.
Yeah.
And then because of that, she handed it to my doctor. My doctor pulls it all up, and they're like, immunology says like this happened here.
Yeah.
You actually have to wait 7 years.
You gotta be careful.
And it's like almost been 7 years because I was like 20, I think, when I had my last.
Yeah. You got a whole different type of immune system now. You know, it's different.
Or maybe I was 21. I don't remember.
Alright, so speaking of your parents and all the stuff that's going on with them, if you were to become inhibited, I mean, you can't speak, talk, nothing, do you have a medical power of attorney or anything like that, or?
I mean, they have it over me, no. If they say they do, they're lying. And my mother's trying to kill me.
They would call them, like, in lieu of, you know.
Yeah, well, you should remove it or put something in writing there that says he has stated that his mother has attempted to commit homicide before.
Yeah.
That is on file.
Well, maybe they'll call your sister, you know.
My sister is not allowed to have medical power of attorney either because she was potentially an accomplice. So none of my family is allowed to be contacted in the event that I am medically inhibited.
Do you have anybody to, like, have as a medical power of attorney?
No, I have no one. No one is allowed to be medical.
So you're just gonna be winging it if you go unconscious.
No, I've been told I'm only allowed to do that because people have tried to kill me before. Because they want to cover up the evidence, or they want to kick me out, or my mother's acting like an actual alcoholic because she's an alcoholic.
Yeah.
And no, you got to make sure that if that's like not something you can put in, I need that put in writing.
Yeah, but you don't have anybody, so we put done.
Yeah. Because I know at Children's Hospital, they did work that out, and it was in there. So my mother wasn't allowed to call. She wasn't allowed to be heard on the phone. Because she's also lied under oath and in records to MD Anderson. So she canceled my oncology appointments. When I was like 16 or 17, she canceled my oncology appointment and then just went to the gym. And the deputies had to go find her. Because I was sitting there waiting to go to my appointment to then I go back to school that day. And she was out. She just decided she didn't want to go. And...
Terrible.
You know, so
that's probably why your sister's out of state. She probably says she's staying over there.
Yeah, no, she was told to stay away. You know, we don't want her life to be affected by my mother as much as possible.
Yeah. Okay, so for the pain issues that you somewhat have, migraines, what do you do when the migraine hits? What do you take? You wing it? You get through it?
Acetaminophen 600 milligrams, I think.
Just go with that, okay.
That's what I was told to take.
That's all you can do, okay.
And the valproic acid also helps with the migraines.
Okay.
Not like that much, I don't think, but my doctor, Dr. Lenajek, he's a specialist for epilepsy, one of the top in the world, and he's the one for the United States, and he practices in New Orleans. He's the whole neurology and stroke clinic, and he was very clear about that it does do something for the migraines because of my epilepsy. I don't know what, and it's probably too complicated for me to learn, honestly, but he made it clear it has some connection.
Okay.
But it's not a treatment for them.
How is your vision after all of this? You go to the eye doctor and all that stuff?
Yeah, I do that when I check my eyes.
You don't have glasses?
I do. I have glasses.
Oh, you are wearing stuff? Okay.
I don't have any way to pay for a new pair of glasses, though.
Okay.
But, because my glasses primarily have, they have like a special filter and coating on them, and a special type of transition lens with a couple different wavelengths protected. so that I don't get issues with my
eyes,
for my epilepsy, really, stuff like that.
Yeah, that melanoma too, I'm sure. You better have they wear those certain sunglasses.
Yeah, I do. Yeah, it works like that too. When I walk outside, it changes into that, and it works. I can't really go outside and look around without my glasses on. Yeah, it's too bright.
So as far as your respiratory system goes, how are you standing with that? Do you have wheezing, coughing, anything like that, shortness of breath?
No,
or
not at all.
Okay with
my
that?
lungs are great.
So your lungs didn't, more neurological things. Okay, so you're holding up good there. What about your heart? Have you had any heart issues?
Nope,
have you had
none. They've tested me. Good. Last EEG was great. Or was it an EKG? Whatever the thing is for the cardiogram. Yeah. Whatever one.
They did an EKG on you. Okay.
They've done like multiple, and the last time I had it
with
was
the quote unquote sort of IBS, whatever there's no word for it, but the
diethylcholine basically
it's fixed that.
Fixed it.
Are you having bloating and stuff too? Like if you eat too much, you get GERD or anything like that, or you don't?
No, that's never been an issue with me. No.
That's good. Okay. Okay, and you're not getting frequent UTIs, and you don't have complaints of joint pain. You've done well with that, surprisingly.
Nope, neither of those.
Okay, so as far as fainting and losing consciousness, that's more in relation to your seizures.
That's just the grand mal. That's there just in case I have a grand mal seizure, so there's like an explanation of like.
Do you know the last seizure you had? Like what the date of it was?
I think I had a seizure not this Saturday. With the previous, because I didn't have my medication, the Adderall or the valproic acid. Or, well, I did have Adderall that day, but then it ran out. So, I mean, if I'm on the Adderall, I can't get a seizure. But the Adderall works for 2 hours. And all the other time of the day, I'm on the valproic acid. But only with both of them can I guarantee there's no seizure. But, like, when it's just the Adderall, I can still basically have a seizure the second it wears off. And it wore off, and then I started having a seizure.
Now, do you have neuropathy on the bottom of your feet, like that kind of nerve damage?
Yeah, on my hands and stuff like that.
Okay. All right, I'm taking.
But they diagnosed it as like idiopathic neuropathy when they did the testing with the needles and stuff a few years ago, because they saw that it wasn't just exclusively the tips of the fingers and things like that. It was like one of the more central nervous system stimulation issues. So I have damage, which just confirmed what they already knew, which was that I have damage to my central nervous system.
Yeah. I'm putting no for all this stuff. Okay. No diabetes. I took out all the anxiety stuff. Let's see if it'll come. You haven't had a hip replacement or anything like that, right?
Oh, no, ma'am. No.
And you don't have osteoporosis from what we know at this point. Your bones are good.
No, they tested my bone structure and stuff like that, and they're very confident that my bones are good.
And you've never had any other skin cancer? It's only the melanoma?
Only the melanoma, yeah.
Okay. That's enough.
They were pretty sure I couldn't get any other types of skin cancer unless I was in the sun a lot, and
how tall are you?
I'm not in the sun a lot.
You're 5 feet?
Yeah, basically. I'm 5'7" and a half or something, 7 something or other. I'm really close to 5'8", so you can just put
what's your weight and rate? What's your weight for the time being?
I have no idea. I haven't been weighed in a little while, but I probably in the last month I was doing better in July, but then now this last week or so it's been pretty hard getting my medication. Maybe the last 2 weeks because I didn't have medication for the valproic acid. I probably lost at least 5 pounds in the last 2 weeks, but before that I was probably back up to weight, which means around 105 to 106.
Yeah, you've been.
The less stuff I have to deal with my parents, the easier it is for me to have more. I burn less calories because it's less stressful.
It's stressful. It's awful.
And a little bit added physical stress just genuinely just burns a lot of calories, and it makes it very hard to maintain weight.
It does. Stress is that way, and it's not good for even the melanoma stuff and everything like that.
And it's not because I'm scared of my parents at all times. It's because it's a lot of stuff I have to deal with.
It's not supposed to be that way.
Yeah.
It's just my husband's parents are freaking insane, and so I get it. I've lived with him. They beat the piss out of him and stuff and all kinds. He's just been through it, and it's so bad. And so he doesn't associate with them at all anymore. We used to, or we tried for a long time. You know how you do. Because it's like your family, you feel like you should, you should be able to have a family, or try to. And, but now we don't anymore because it's too miserable. He's like, I don't care, I'd just rather have nobody, which is sad. But I'm telling you, he's doing better. We haven't talked to them in 2 years now. It's been a long time. And initially it was kind of bad, but like I think once he really got away from that constant abuse, because it's just psychological. Like even when we would go over there, it was just weird and like you know how it is, drama. And he's just better without it, and that's sad. But it's just not good on your health. It's really bad. Abuse is nasty though. It's nasty, nasty. And he's done like counselors and all kind of stuff too.
Yeah, I've done that. Yeah.
You know, it helps, but it's like you just, I don't know, it doesn't.
It's much easier just when you're not in contact with them.
It is. It is. And in your case, because you're not well, you know, that's what really sucks, because you're vulnerable.
Yeah.
Making it worse. You know, like if you didn't have to deal with that, you could really get away. Probably why your sister got the hell out of Dodge, you know.
Yeah.
It's sad. Your hearing is okay though, despite the
Yeah,
nerve
they did testing. They did more testing. Well, when I was first at UMC because of my mother, because she'd been screaming at me, like when I was asleep or on other medication for my narcolepsy, that I'd be like almost unconscious, like or comatose kind of state because of the nature of the treatment, and she would just kind of stand there and scream at me because she was going insane, I guess, or just drunk. I'm not sure, but she'd do that, and so they tested me to make sure that right afterwards, that as soon as they could, that my hearing had like a baseline, and they compared it to what some records they had previously to when I was like really little, and they said that it didn't look like I had any hearing damage, so I just got lucky because someone screaming in that proximity at her volume level, they was basically guaranteed to have caused me hearing damage, but they said I just got lucky.
Some people are crazy.
So I just can't like have that happen again because she'll do that. She'll just stand there and scream, which is weird.
Nuts too. She's crazy. Same. They used to drink and like just they're just nuts. It's sad, but it is what it is, you know. All right. So anxiety, we're gonna take it off. I'm gonna say condition resolved. Get rid of it. Chronic pain. But you ain't got that no more. Done. We'll take depression off. I mean, you ain't.
The chronic pain's probably on there because of my shoulder. You might want to keep that.
Okay.
Yeah. And that's because of my shoulder. I didn't even think about that. Yeah, I've had a lot of reconstructive surgery on my shoulder because I dislocated my arm because I fell asleep and then it probably just popped out of socket because I laid on top of it for like 10 hours or more, 20 hours. I can sleep for 20 hours. It's not a big deal. So like that kind of force does over time, it will slowly pull your limb out of socket. And because that's just how it works with the physics, and that's what they thought happened because I didn't know it was out of socket, and I kept working out, so I ended up completely like fucking it up.
At least you're trying though, with the working out and all. I mean,
I felt good about that. I came into my oncology appointment at Children's, and my new oncologist, right after Morales left, it was like one of my first appointments with her, and she asked me she ran into the room after I had done my X-ray, and she was gonna discuss my results with my chest X-ray, and she just like ran in there. She looked scared to death, and it was because
you were working out.
Yeah, because I was working out with my arm out of socket, hanging there.
Oh no, that's a problem.
and I didn't know, and she was looking at me, and I was sitting there like I wasn't in pain, like I didn't know.
Well, you've
so
been
she
through
was,
so much. I've seen those kids do
really scared. She was also young, so she didn't have that many patients yet.
But these oncology kids, they're like, it's a whole different breed of people. I'm telling you.
Yeah, it was her first job as like a real like primary oncologist for the department.
No, they don't know. Y'all are a different breed.
And I'm probably a pretty exceptional patient to have as a patient, so it was kind of it probably scared her even more. But she was like, she got me into surgery like immediately. They wanted me that day, but they pushed it back over the weekend because they wanted to make sure that another doctor could handle it. And even though they were there that day, they were like, okay, we're gonna bring you into surgery right now. And I'm like, why? And it was like, well, your shoulder, like, can you like lift it above your head? And I was like, my arm above my head, and when I couldn't move it, I was like, I haven't tried that yet. And then she's just like, you didn't notice? And I was like, I didn't notice. I don't know. But that's probably what the chronic pain is there for, because it was painful enough where I couldn't move my arm. I had prescriptions that needed to be covered for high doses of lidocaine patches, which I still use sometimes. I need to get another prescription, I guess, for that. And that I'm sure that's what that is. Yeah.
Okay. So I'm gonna keep that thing. Yes.
Yeah. Sorry about that. I don't know. it just shows how little
Because
I
if you
remember.
want to get the patches too, we need some negative charting, sadly. All right, well,
What does that mean?
like putting like pain,
yeah.
some kind of
Yeah, no, because that's definitely. I definitely needed the patches to like keep it from seizing up because it was causing some seizures too.
Yeah. Epilepsy is another weird. Did you have epilepsy before you did all your treatments?
They think I did, but I just never had issues with it until the seizure threshold was lowered because of the treatment.
Oh, and then it triggered it.
Yeah, so before that I probably always did. I just got it when I was
Maybe you
born.
were having those little ones, the little absent type seizures, and then you turn grand mal.
They just have no idea. I never seemed to exhibit symptoms of it. They said I was always in water too much when I was swimming and stuff, so they're shocked I didn't drown, things like that. But the fact that when you do have a seizure threshold as low as mine, it doesn't exactly, make sense for it not to be just something that was in the background. I was born very premature, so they just are kind of chalking it up to that. And there was always a lot of other things going on with me, so.
Yeah. What is this asking me? It's saying I'm not in the right location. Yeah, I am. Might as well. It's saying meeting number, different location. I don't know.
Oh, has it changed my address in the system yet?
I don't know. Maybe it didn't. I had your address. That's weird. I don't know. Freaking stupid people. I don't know. All right. Well, hopefully these people will contact you as far as the case management referral goes. Make sure that I put it in there. If not,
because getting the medication shipped would be extremely expensive.
Is that an option? I wonder.
Yeah, because I can't afford to pay for an Uber to bring me to the doctor's and back or to the pharmacy a bunch of times. Like it's really expensive. I don't have the income for that.
Yeah. An urgent or emergent summary? No, I don't need that. Okay. I might even leave you their number. This insurance, let's see who you have.
I have Aetna Better Health of Louisiana.
Yeah, because I was going to say your other option to do, you can call your Aetna directly too, and let them know, like, we came out, you're having these issues with getting all this stuff covered.
I've called their case management before, but their case management can't do anything about them having only the contract for pharmacy stops after a physician's appointment and nothing else. I'm not allowed to be brought to the pharmacy, even if I have to be brought to the pharmacy multiple times to pick up different medications
so they don't
on order
offer
of a physician. Yeah, they have some sort of contract that prohibits them from offering it for no real reason.
Wow.
But other patients that I've met, even in medical transportation, even at the same time, like going to my appointments and stuff, they have different insurance companies that are like set up for their type of patient, and all of them do have it, but they also might have incomes and things like that. They may work. They don't have terminal status. All the terminal patients and all the children are like me. We don't have access to the pharmacy stops, like to be brought to the pharmacy and back home.
Right.
I think it may have something to do with like when I was at Children's Hospital on my infusions, they had a bunch of issues with companies leaving patients at Children's Hospital and just not picking them up.
But now you're 27. I don't get it.
Well, they have like some legal obligation to where they have to bring me home regardless, but just by accepting the job. So like no matter what happens, the patient has to be like brought round trip kind of a thing. But like
so they don't have any pharmacy contract to even set up deliveries. Like
I'm not sure. I've never asked about deliveries through them before, but I've never heard of you guys being able to put in a referral to like have it shipped to you. That could be new. I'm not really sure.
Well, we'll see what they have to say. I mean, hopefully they call you. I mean, I don't know what happens after I put things in, so keep that in mind. Like, I upload this stuff. That's why I just want to make sure that, like, but you can always, you can call your insurance too.
Yeah.
So, I mean, maybe I would still call them, even though we came out, just because I don't ever trust the system. I hate to say that. I'm just trying to be honest with you because I want you to get your stuff. Because you know how it is. I mean, I don't know. You put something in, I don't know who the hell calls. You know what I mean? I don't know nothing. I just come out here and
do you know what number they're going to call me on? Oh, okay. Well.
No, because I work for Signify, not Aetna. So, like, I go out and I do these evals, and then I just upload it to, like, the primary care doctor and the insurance company. So, like, what the insurance company does with it, I don't really know.
Well, as long as my primary care doctor gets a copy of it, I think I'll just be able to talk to her.
Yeah, or talk to them and let her know, and you're probably going to be seeing her soon, huh? You'll be going back to her 3 months or so?
I mean, that's what I wrote it down as. I'm not sure what date it was.
And maybe ask her, like, you know, is there something, but it's going to be the insurance company. It would be Aetna and primary care teaming up. So Ochsner has a little program that they have a pharmacy there, but you don't go to Ochsner, Maine, huh? You go to UMC.
Yeah, they don't let me go to Ochsner anymore because they had a bunch of issues. I went to Ochsner before. Some of my physicians were there, and they moved over to UMC because Ochsner had a bunch of issues with medical records. Right. They had people deleting medical records and stuff like that because they had other insurance contracts, and they had to like buy out a bunch of different hospitals to like themselves so they could like separate a bunch of different. They had like some private hospitals that weren't Ochsner, but still had like Ochsner managing them. But then they had to just purchase them wholly to get rid of the problems, and I think they don't have those problems anymore. But because that was a while ago. But when I was in high school, they had some laws change, and then all of a sudden, a lot of these smaller places caused a ton of problems for a bunch of different hospital systems. And now we just have UMCs like LCMC,
UMC has a pharmacy in there.
And the Ochsner.
If they would give you 90 days of your medicine, they give you enough.
There's no way they can give me 90 days. I think that's pretty much impossible. I mean, they can't with the Adderall, and that's what I need. They can't even give me 90 days properly with the valproic acid. They've been.
I don't think you get that.
There's too many issues. I've been able to get.
And they probably can't ship Adderall.
They've been refusing to ship. Walgreens doesn't even know why, but they've been having issues this past week just shipping me the valproic acid when they've shipped it for years.
I know, because you got to show an ID for that. I didn't think about that, huh, with IDs.
I do have the IDs on file with them, too. I have my passport and stuff.
But they make you pick it up. That's probably some of it, too.
Yeah, which is weird because they didn't do that before.
Yeah, it's gotten bad from the abuse and stuff. Yeah, oh, man, you're in a tough spot. That's tough with the medicine, because the medicines you need.
If I could get them to just transport me there, then it wouldn't be an issue.
Yeah. And so they won't give you transportation to pick it up? Like, when you call case management to set up a ride, they don't do it? It's only to the doctor's appointment?
And then from the doctor's appointment to a pharmacy and then to home.
And then to home.
I did the pharmacy stop this past week.
Okay.
But I don't know if maybe your referral or something could escalate things to give me that ability under the insurance company, because they don't have much of an issue with getting stuff approved for me. It's not like there's monetary limitations on me. From the United States, I have an unlimited budget. Because of the type of patient I am. With the childhood cancer, we're all like that. Yeah. They should be able. That's what I'm saying. But it's just hard for me to figure out like how I go about.
So you have to go to the pharmacy, right? Because it's ADHD stuff.
Yeah.
So if you call, let's say you had medicine over at Walgreens and you call Aetna, can you schedule just a ride to the pharmacy?
It hasn't worked in the past, and they told me they're not able to do it in the past too. They also don't want me being left there, but I don't think we have that concern anymore. I think there's enough.
They don't wait, like it's just a pickup and drop off, right?
So for me, in the past, they have waited, but like...
They probably would.
They probably would.
If you call ahead of time and you know you're picking them up, and maybe if you call, just let Aetna know, like, listen, if I don't get this ride, I'm not going to have it. Because they're going to want you to have it. I mean, these medicines, you got to have it. I mean, you're talking about seizure medicine, you got to have it.
I guess I could call them again and talk to them about it, but unless their contract has changed, I think they'd have to do something special for me. Yeah. And I'm not sure how I initiate that. Yeah.
Golly, that's aggravating. That's tough. You really need your parents to straighten up and help you out. Or your dad, your mama, not your dad. He can't straighten up. He's got Alzheimer's, he's bad, also he's bedbound kind of stuff.
No, he could drive. He just doesn't want to drive me right now.
Yeah,
he doesn't feel like it.
Clocked out,
Yeah, I guess. I don't know. I mean, he does little stuff on his own just because of his condition, I guess. And he also still has to deal with my mother. I mean, it's not like he's good, but when he drives, he drove me every month for the first 6 months of this year to the pharmacy without an issue.
Yeah.
But I don't know. Now he stopped. Yeah. He also didn't answer the phone when I called. I contacted my grandmother because I was worried about him. Yeah. And she wasn't very helpful, but she's old, so I don't know.
Well, I'm going to be praying for you. You got a lot on your plate, but you're doing pretty good. You got a little setup here and all, so that's nice. How long you been here? A year?
Last September, I guess.
Oh, you've been here a year. You've been here a long time.
Or maybe more like last October, I guess.
Okay, and your parents are in this area, in
Covington. They live in Beauchamp. They live at
they're
that.
in Beauchamp.
They're at that
Oh,
address.
they're here. Okay,
Yeah.
so they're not far from you.
I could walk there. If the road shut
Really?
down during a hurricane, I could walk across. I know how to get into Beauchamp from the street. So, I mean, like, I could just go into there if I wanted to.
Yeah.
I mean, the main gate is, like, right there. So, like,
Yeah.
I could also do that.
I know.
I wouldn't be able to do that while there are cars on the road, but, like,
Right.
I've literally walked from my house at that address
Yeah.
all the way to school at Cedarwood here after Katrina. I used to do that all the time.
Yeah.
Because I had to go to school, so I walked.
Yeah.
And, you know, I wasn't really supposed to do it, but
No, probably not.
there were still trees on the road, you know?
I don't think it was good for you.
No.
Look, this is down here.
I was like 7, so.
Yeah.
They didn't really care.
Is that you with all that hair? Look at that hair you got.
Yeah, I was a freshman, I think.
You got some weight on you right there.
I was on growth hormone, I think, at that time, so I had
Yeah.
a little bit more weight. I haven't
Yeah.
gotten close to that since.
Your sister's so cute. That's her.
Yeah, that's her in high school. That's her in high school too, but like 8th grade maybe.
I'm sure they worry about you, even though they're not right in the head all the time, you know, because with all you've been through already, they probably. I'm sure she worries somewhere in that head.
Yeah.
All right, well, I'll be thinking about you, but call Aetna at any time. You know, if you keep getting in a jam, you let them know. You know, hey, look, I'm gonna be able to use this and stuff, you know, and they're gonna do something.
Okay, thank you, ma'am.
All right, buddy. Good luck.